Nowadays, knee replacement has become very common operation. We want to know whether we can do two knee replacements together. Both bilateral knee replacement same time. The answer is yes. Because what happens is people who have severe arthritis, severe deformities in both knees, if we do one knee replacement, still they have problem with other knee, there will be leg length disturbance, rehabilitation will be difficult, walking will be difficult. Again, they have to come back and do the other operation, which is again one more procedure. So people who are fit, healthy, following all the investigations, it's better to do bilateral or two knee replacements together because it is less expensive, same admission, and rehabilitation will be simple because whether we do the one or two in a fit patient, the risk will be same and it will be more comfortable for patient to walking and any other rehabilitation.